So here we have our vascular man, and our vascular man has blood vessels that run all the way down to the legs, the bottom of the feet, and he's got blood vessels that go to the hands, blood vessels that go up to the head, and blood vessels that are supplying the lungs, supplying the kidneys, supplying the liver, supplying the intestines, supplying everything. Now, I mention this because there's a disease of the blood vessels, of the vasculature, and it's called vasculitis. Vasculitis. Itis means inflammation, vascule means blood vessels. And so we'll see many different types of blood vessels affected. You'll see blood vessels in the heart affected. So the main vessel, the aorta that comes out, can be affected. The vessels that branch off from the aorta can be affected. And those are large blood vessels. And then there's blood vessels in the arms that get a little bit smaller, in the kidney as well, and in the legs. And those are medium-sized blood vessels. And there's also medium-sized blood vessels that go to the lungs, go to the liver, the kidney, and the intestines. And then also there's small vessels that you really can't see unless you look under a microscope. And these, of course, also go to the different organs, the lungs, the intestines, the liver, the kidney, and maybe your skin. I'm going to right here show the skin, to your nerves. And so they're all over the place. In this disease, you can have inflammation of many different vessels. Some vasculitides, the plural for vasculitis, can affect the heart vessels only, or the intestines and the kidney and the liver, or some only affect the lung and the kidney. So it just really depends on the vasculitis you're looking at. But we break it down into large, medium, and small vessels. And along with the local damage that we see in these different organs from this inflammation, we can also see flu-like symptoms such as fever, chills, shivering at night, night sweats. So these are just general immune symptoms that are caused by your immune system releasing different proteins and chemicals that are actually not only toxic to pathogens, but also toxic to the body itself, at least when they're released in large doses. Now let's go ahead and take a look down. So here we'll start with the inside of a blood vessel. And I'm going to draw these blood vessels in this purple color. Here is the endothelium. So that's the lining on the inside of a blood vessel. Here I'm going to draw the wall of the blood vessel. So this is the vessel wall. And I want you to think of blood vessels like pipes. So they'll have a wall, and then you've got all the other fluid that travels in it. And so this would be your outside of the blood vessel, and this will be inside. And for a little bit of completion, I'm just going to draw the other wall of the blood vessel. And so we know blood vessels get their name from blood, so blood's carried in them. You also see white blood cells, which are immune cells of the body. And you can also see different proteins that are in the blood, such as clotting proteins, immune proteins, and whatnot. And there's actually a very specific immune protein called an antibody. Now these, I'm drawing pretty big compared to the red blood cell, but they're actually very tiny, and I'm just doing this to show you what they kind of look like. So there are these Y-shaped proteins that are used for the immune system to recognize pathogens. For our intents and purposes, let's just imagine them to be like a plug. And so a plug will fit into a wall socket, and when you plug it in, you get whatever you're plugging in to turn on. And so the idea here is that when antibodies find a protein that activates them, they'll turn on, and when they turn on, they'll recruit white blood cells to come over. Now, the antibodies are used to find foreign material, so they act like a guard dog. A guard dog letting the master know there's something going on. Now this is normally good because we want to alert the immune system that there's a pathogen, there's something bad, and we need to destroy it. In vasculitis, the issue here is the proteins are our own self, the endothelial lining, as well as in the blood vessel wall. And so these antibodies will bind onto these proteins, and they'll start to alert the immune system to come over. And when the immune system comes over, it releases immune peptides that cause damage to the cells. And so that's what's really happening in vasculitis. You're getting blood vessel damage and inflammation. And these white blood cells will recruit more white blood cells and tell them to come over, and we'll get more and more cells recruited to this area, and more swelling and more damage, and more release of immune peptides. And these immune peptides will go on down the system and cause those generalized symptoms that we saw: fever, chills, night sweats, all of this, fatigue, just to name a few. Now let's take a look and see what happens when this inflammation runs rampant. I'm going to erase a lot of this just to kind of get this out of the way. When you have inflammation, you have swelling. These blood vessel walls swell up because fluid from in the vessels are getting in and filling up this space. Another thing that the white blood cells do is they release immune peptides that open up this junction right here, which also allows white blood cells to get into the cell wall. And with damage to the cells, we get leakage of material that's within the vascular wall, within the blood vessel wall. Among this material is fibrinogen, which we'll talk about in a second. But also, remember what else we have in that wall. We have the protein that your body is mistaking as foreign. And this protein gets all over the place. And so then the antibodies are going to try to bind onto this, and they may hold hands and share some of these, and they will form these complexes. These are immune complexes. And immune complexes are big enough to travel down the bloodstream and get stuck somewhere downstream. Places that the immune complexes like to get stuck include the kidneys and the joints. That's right. And so you can get joint pain or kidney damage because these are all activated, remember? So they've bound onto this protein, so they're all activating other white blood cells. And now, as I was saying before, there's other proteins. There's one called fibrin. Actually, it's called fibrinogen. But when it interacts with clotting factors in the blood, fibrinogen, ogen is usually the inactive form of a protein, so fibrinogen becomes the active form, fibrin. What fibrin does is create this net-like mesh that forms a clot. It's essentially the body trying to patch up something that's broken. And so it knows it's broken because these clotting factors should never be touching fibrinogen because this wall is normally intact. So now this huge clot forms, and there's a lot of cell death. So cell death, along with this fibrin formation, we see something under the microscope that's dubbed fibrinous necrosis. Necrosis is cell death. Fibrinous comes from the term fibrin. And so let me go ahead and erase this immune complex, which can be causing damage elsewhere, remember kidneys and joints, so that we can see that the red blood cells are having a tough time getting through here. Because, they're going to bounce around, they're trying to come through here, bounce all over the place. And it creates this very disorderly, turbulent flow. Flow should normally be straight, orderly, but this is turbulent. So when you take a listen to this blood vessel using a stethoscope, you can actually hear what sounds like a whooshing sound. Whoosh. This is called a bruit. And if you feel it, you're going to feel what's called a thrill. This feeling of rushing blood, like something's rushing underneath your finger. And so these are some signs that you may see if a patient has vasculitis. So let's go ahead and pull this all together. And let's just think about the local vessel symptoms. So here I'm going to draw a large vessel. In fact, we'll call this large and medium-sized vessels. And here we'll show just small vessels that have maybe just one lining. And let's illustrate the vessel wall so you can really see what I'm talking about. Here's the vessel wall of large and medium vessels. And the vessel wall for small vessels is just this thin line, okay? With large vessels, you get blockage of blood vessels. You've got all this fibrosis going on from damage. And fibrosis is just another word for scarring. And so blood flow is really reduced. So we've got decreased blood flow. And because there's so much resistance through here, blood is having a tough time getting through to the other side. There's also a decrease in blood pressure just because of all the resistance. And so you'll see this in large and medium vessels. And so this can lead to decreased blood flow and decreased oxygen means cell death down the line. And lastly, we've got small vessels. If small vessels break, you see that this wall is so thin, so the blood vessels can escape from this wall. In organs, let's scroll back up here and show you, where small vessels are, in like the intestines, the kidneys, the lungs, if you have breakage, let's scroll back down, you see blood in those organs. So you see blood loss in organs. So for example, it might not be a lot of blood loss, maybe just a little bit, but you can see blood in the urine if it's from the kidneys, blood in the stools if it's in the intestines, and blood in mucus if it's in the lungs. You can also see blood in other areas too, just underneath the skin, which may appear like a rash. And you'll have this sort of dotted pattern of this rash because little tiny vessels in that area of the skin are getting damaged and bursting open, and red blood cells are escaping. And so the concept to keep in mind is decreased blood flow, escapage of red blood cells if it's small, and of course you'll also get decreased blood flow if it's small as well. And your general immune symptoms.